Have you ever wondered why your knee hurts after golf or other sports? Well, I've got the answers for you. Stick around until the end of the video and I'll also tell you how to fix it. I'm Brad Homan, a board-certified orthopedic surgeon in Orlando, Florida, and welcome to my channel where I talk about how to keep your body strong, pain-free, and performing its best, both on and off the golf course. My passion is to get people out of pain and more active without surgery. I believe that the body is a healing machine, and I like to focus more on prevention and healthy lifestyle changes to make people better. It might sound strange that a surgeon prefers keeping people out of surgery, but I really do believe in letting our bodies do what they do best. We can optimize our health and support our joints to keep active without pain. In my over 20 years of practice, I've treated thousands of knees, and I'm going to give you some insights and tips on how to do just that. If you're a golfer dealing with knee pain after a round, especially after walking 18 holes or hitting long drives, this video is for you. Let's talk about why that's happening and what you can do to get back to playing your best game. So let's dive into the 5 most common causes of knee pain in golfers. And number 1 is overuse and repetitive stress. Golf might not be high impact, but it's a repetitive sport, especially for that lead knee. Every swing creates rotational stress, and over time, this twisting can irritate the structures in the knee, especially if you're playing or practicing often without enough recovery time. So I have got a plastic knee model to sort of demonstrate a little bit what we're talking about here. So the knee is known as a hinge joint, which means really the primary motion of the knee is bending and straightening, what we call flexion and extension. There are ligaments, which are structures that connect all of the bones that prevent your knee from going side to side too much or even prevent rotation. And so if you're doing a sport where you're loading the knee and rotating back and forth, then over time, those ligaments can become irritated, and that can be a cause of a lot of pain. So number 2 is poor swing mechanics. So on that same note, many golfers don't realize that slight flaws in swing mechanics like limited hip rotation or poor weight transfer can overload their knee. When your hips or your ankles aren't mobile enough, your knee becomes sort of the middleman that takes that extra strain, and that can lead to pain on the inside or the outside of the joint. Number 3 is weak or imbalanced muscles. Your knee doesn't act alone. It depends on strength and stability from your hips, glutes, thighs, and core. Weak glutes or tight quads can throw off alignment and increase joint pressure during your swing and follow through. A simple stretching and strengthening program can make a huge difference. Number 4 is underlying degenerative changes. If you're over 40 and starting to feel stiffness, grinding, or swelling, it might not just be your swing. Mild arthritis or cartilage wear could be the culprit. Even early degenerative changes can flare up with the repetitive load of golfing. But the good news is we've got advanced options now, including regenerative medicine treatments like PRP, platelet-rich plasma, or stem cell therapy to help restore joint health and reduce pain without surgery. Number 5, poor recovery and inflammation. Golfers often underestimate recovery. Walking several miles, squatting to line up putts, twisting through hundreds of swings can add up. So without proper hydration, stretching, and inflammation control, your knees can stay irritated long after you leave the course. A few days of rest, icing, or even an anti-inflammatory diet can help your knees recover faster. I've created some instructions for golfers of 5 things you can do to fix your knee pain. Click the link or go to golferkneepainnomore.com to check it out. So here are 5 easy tips to fix or prevent knee pain. And number 1 is warm up before you play. Muscles and tendons can get tight with inactivity. If you start playing golf with tight muscles, it's going to cause pain in your joints. So do a few leg stretches, some light squats before your first swing. Even a few minutes of brisk walking or riding a bike is enough to loosen up those muscles and protect your joints. Number 2 is strengthen your legs and your hips. I tell my patients all the time, your thigh muscles are the shock absorbers for your knees. Those muscles wrap around and they support your knee joint. So a low impact strengthening program outside of golf can help offload the impact that occurs with golf or any sport. If your muscles are weak, they won't protect your joints from all that walking, squatting, and swinging. Try simple exercises like bridges, step-ups, or mini squats. A regular low-impact fitness program will make a major difference. Strong legs take pressure off the knees. Number 3 is work on your swing technique. So let's face it, a golf swing can be pretty awkward. A smooth, balanced swing helps your knees move more naturally. And I'd mentioned before that too much twisting and loading the knee can aggravate the ligaments. So the best way to avoid injury is to use proper mechanics. And if you're not sure, ask a golf coach or a physical therapist for some assistance. Number 4 is wear good shoes or use knee braces. So shoes with a good grip and support can make a big difference. You gotta be careful though, because too much grip can be a problem because it doesn't allow your foot to move enough. And if your knee feels unstable, a light sleeve or a brace can help as well. That little bit of compression and support can go a long way. Go to golferkneepainnomore.com, where I demonstrate some examples of braces that can really help ease the discomfort while playing your game. Number 5 is ice and rest when needed. If your knee hurts after a round, ice it for 15-20 minutes. And remember, sometimes your body just needs a break, so rest days can help your body heal stronger. Getting enough sleep at night is also important to get your body recharged and ready for the next outing. So if your knees are talking to you after every round, it's not just part of getting older. The key is to identify why it's happening, whether it's mechanics, strength, or early arthritis, and address it before it limits your game. General good health and wellness will keep you active without pain. And so I would be remiss not to mention things like healthy lifestyle and wellness. We discussed an exercise program already, and I think it's extremely important for all of your joints to be in a full body, low impact exercise program, and that's for day-to-day stuff as well as sports. But the other part is eating right. We talked about diet in the past, and you know that diet will help not only lose some weight, but it's also important what you eat, because the foods that we eat now are loaded with additives, processed foods, added sugars. All of these things can be inflammatory, and those chemicals that you ingest can really impede your body's ability to do what it does naturally, which is to try and heal and make you better. And weight loss is important as well. So we definitely have an obesity problem in our country. Even if you're not obese, but you're a little bit overweight, that extra weight on your knees while you're active over time will cause extra pressure on those joints. So losing the weight, eating right, low impact exercise, that is the best way long term to keep your legs feeling good. Basically, what you want to do is get your body to do what it wants to do, which is to heal, recover, and increase energy and vitality. So in future videos, we're going to dive deeper into specific exercises, recovery strategies, and regenerative treatments that can help you keep playing pain-free for years to come. Golf should be fun, not painful. So take care of your knees, and they're going to take care of your swing. I'm Dr. Brad Homan. If you found this helpful, hit that like button, subscribe, and sign up for notifications for more tips to keep your body healthy and your game strong.